Hello and welcome to this presentation on training modalities and neuromuscular control. The aim of this paper was to assess if lower body weight training in adolescents increases neuromuscular control greater than resistance training. For the first part of this investigation, I looked at anterior cruciate ligament injuries and how they both occur through contact and non-contact aspects of athletic activity. I also did some research on the preventative techniques used to hopefully reduce this risk of injury. And I looked at how body weight training focuses on certain aspects such as agility and balance to help prevent such injuries, while resistance training focuses on strength and power development. Over the last decade, age has also been a factor influencing ACL injury risk, and so this was also investigated throughout this paper. Landing mechanics in female adolescents has been shown to change through pre- and post-pubescent stages of development. Decreased neuromuscular control of the knee from pre to post-pubescent stages has the ability to decrease dynamic knee stability. From the rest of this research, I found that individuals who are in the prepubescent phase of development have a decreased risk of ACL injury, and once they have continued through later stages of development, that increase in risk develops. When it comes based on age, developing and including neuromuscular training at a certain age has shown to affect lower extremity injury risk. Younger athletes are more receptive to neuromuscular training compared to individuals of older ages due to the fact that they are more engaged and more willing to accept this type of training. Pre or early adolescents showed greater risk reduction compared with later adolescents with the implementation of neuromuscular training. So a research article by Meyer et al. In 2013 indicated that it may be optimal to implement neuromuscular training programs during pre or early adolescence before the period of altered mechanics occurs, which would be post-pubescent. Types of neuromuscular control that I researched were balance and agility. So integrative neuromuscular training focused on skill-related fitness, such as agility and balance, can maximize neural development during pre- and post-adolescence and optimally prepare the youth to capitalize on the associated factors which contribute to motor performance following the onset of puberty. Injury prevention effects through a speed and foot agility protocol reduce lower extremity injuries in trained female athletes by 19% compared to athletes who did not go through a neuromuscular training program. Dynamic balance may also help provide an athlete with dynamically stable core that can be more prepared to respond to high forces generated at the distal body parts during athletic competition. So overall, a neuromuscular training program including agility, balance, and resistance, has been shown to decrease the risk of ACL injury in adolescents. Functional core and strengthening and balance training can improve dynamic balance, while resistance training is going to reduce injury based on the beneficial adaptations that occur in the bones, ligaments, and tendons. The goal of functional balance training and core strengthening is to bring the athlete to a level of core stability and coordination that allows them to properly reduce force, maintain balance and posture, and subsequently regenerate force in the desired direction. For resistance training, the goal is to improve strength and power of individuals of any age. It produces increases in strength in female athletes when utilizing correct programming and volume. Programming should be progressive with an initial high volume and low intensity protocol. Prepubescent athletes can improve lower extremity strength and power through short-term resistance training. Neuromuscular training programs, including resistance training exercises, improve lower body strength and power, especially when focusing on movement quality and technical efficiency. Bodyweight training. The effects of core strengthening gains may be best attained with the incorporation of functional balance and core strengthening into several aspects of an athlete's training program. Decreased impact force developed through balance and stabilization exercises suggests that balance and dynamic stabilization training are important to improve force attenuation strategies when landing. A combination of plyometric training incorporating with dynamic stabilization exercises have been proven to reduce impact landing forces without the use of external loads. Overall, from my research, I found that integrative programs that increase muscle strength, enhance movement mechanics, and improve functional abilities appear to be the most effective strategy for reducing sports-related injuries in younger athletes. By incorporating a neuromuscular training program, including resistance, balance, and agility from a younger age or that pre-pubescent stage of development, athletes are more likely to have a reduced rate of ACL injury risk. These are my references, and I hope you have enjoyed the presentation.